Application of the VertAlign spinal support. The Brimmer Group VertAlign spinal support is a versatile, off-the-shelf, pre-molded, rigid TLSO spinal support designed to satisfy a broad range of patients for whom non-surgical and/or surgical intervention may be indicated. The VertAlign spinal support was conceived by a certified orthotist with over 35 years of experience in treating patients with a compromised spine and was produced from actual patient molds. The result is a unique select and supply system at the point of care that is X-ray, CT, and MRI compatible. Selecting the appropriate anterior and posterior shell combination using the decision tree. Using the decision tree located on the back of the package, select the front and back shells from the display. Male gray sizing chart. Small, height 5'4" to 5'7", weight 115 to 135 pounds. Medium, height 5'6" to 5'10", weight 135 to 165 pounds. Large, height 5'10" to 6 feet, weight 165 to 190 pounds. Extra large, height 6 feet to 6 feet 4 inches, weight 190 to 250 pounds. Slim, height 5'7" to 6 feet, weight 120 to 145 pounds. Female blue sizing chart. Small, height 5 feet to 5 feet 4 inches, weight 105 to 125 pounds. Medium, height 5'2" to 5'6", weight 120 to 145 pounds. Medium plus, height 5'2" to 5'4", weight 185 to 210 pounds. Large, height 5'3" to 5'7", weight 140 to 165 pounds. Large plus, height 5'2" to 5'4", weight 200 to 245 pounds. Extra large, height 5'4" to 5'9", weight 160 to 185 pounds. Extra large plus, height 5'2" to 5'5", weight 230 to 265 pounds. Slim, height 5'5" to 5'9", weight 105 to 125 pounds. Trial fit of the posterior shell. Before breaching the integrity of the shrink-wrap packaging, place the posterior shell on the patient's back and palpate the following anatomical landmarks to be certain you have the correct shell for your patient. Adjust the shell size selection as needed and repeat this procedure until the most appropriate size is identified. Posterior shell anatomical landmarks. The superior edge of the brace should fall within mid-scapula. The inferior edge of the brace should be even with S5. Trial fit of the anterior shell. Place the anterior shell on the patient's front and palpate the following anatomical landmarks. Adjust your shell size selection as needed and repeat this procedure until the most appropriate size is identified. Anterior shell anatomical landmarks. The superior edge of the brace should fall within about 2 finger widths of the sternal notch and avoid impingement of the clavicles. The inferior edge of the brace should fall 1 finger width above the symphysis pubis so as not to impinge on the prominence when the patient is seated. And the lateral brace edges at the loops should not reach beyond the patient's sagittal midline. Because of the flexibility of the VertAlign spinal support, you are able to mix and match anterior and posterior shells to accommodate a variety of anatomical needs. Approximately 90% of adult males and females with normal anatomy can be fitted with a VertAlign spinal support. The Brimmer Group recommends that practitioners consider ordering a custom VertAlign for patients with non-standard anatomy or with significant degrees of thoracic deformity. Applying the VertAlign spinal support. The patient must be standing erect or lying supine for application. Once satisfied with the trial fit of your VertAlign shell selections, remove the shrink-wrapped covering from the shells and place the enclosed underliner on the patient. At this time, make sure all screws on the anterior and posterior shells are tightened. Attaching the anterior and posterior shells. Attach the shells by placing each strap through a corresponding loop to the point of the loop fabric on the strap and secure. Place the posterior shell in position on the patient's back and assure the top of the shell is toward the patient's head. If the patient is lying supine, roll them 90 degrees onto their left side and place the shell on the patient's back in position. Return the patient to supine position. While holding the posterior shell in place, wrap the anterior shell around the patient and into place. Secure the center strap and check the position of the anterior and posterior shells. Care should be taken to avoid tightening the straps to the point where the VertAlign restricts patient breathing. Adjust the bilateral strap length position and/or corresponding loop position as needed. You should be able to insert an index fingertip under the brace along the edges. Once in the proper position, secure the remaining straps and trim to optimum length. To help assure proper performance of the VertAlign spinal support, we strongly recommend you have the patient or a family member demonstrate reapplication proficiency before leaving with the product. Review the enclosed information booklet with the patient as necessary. Accessories and enhancements. Lamb's wool strips. In cases where extra padding may be needed on each side of the spine, every VertAlign comes with 2 lamb's wool strips with hook and loop attachments. To apply, simply cut the strips with tape scissors to the desired length and/or shape. Remove the covering from the adhesive backing and apply to the inside of the VertAlign shells where needed. Full lamb's wool liner. Full liners are generally not used with rigid TLSOs because of moisture, bacteria, and the resulting potential for skin maceration complications. However, should a practitioner wish, full lamb's wool liners with application instructions are available by calling customer service at our toll-free number 800-428-2304. Adjusting strap loop position. Straps and/or loops may be repositioned to provide extra girth and/or, if need be, to assist the patient with self-application of the VertAlign spinal support. Caution: care should be taken not to exceed the length of the lateral tongues. Doing so may cause patient discomfort and/or skin lesions. The VertAlign spinal support is for single patient use. For more information, contact your local Bremer Group representative or call toll-free 1-800-428-2304. The Bremer Group VertAlign Spinal Support, embracing innovation.